We have a number of healthcare workers who are also patients with COVID-19 infection, and they occur across many different settings. That includes in the public hospitals, healthcare institutions, in the private hospitals. We've also seen some healthcare workers in the long-term care setting also having COVID-19 infection. I do look at each of these cases, trying to determine where they might have got the infections from. And a number of these individuals, in fact, got the infection, we believe, from travel outside Singapore. And they had traveled to countries around the world in our region where the risk of community spread, in fact, is much higher than what it is in Singapore. We believe that travel history created an exposure to them. They got infected and they came back to Singapore. And after that, developed their symptoms in Singapore. But that exposure, in fact, occurred while they were overseas. There were others that, in fact, as Minister Lawrence Wong had mentioned earlier, in fact, fit that same pattern where it's household context, and it was in fact a family member who had infection and subsequently spread it within the same household. And it just so happened that the family member that got infected was a healthcare worker. At this point in time, we have not got any evidence that any patient has spread infection to a healthcare worker. We've looked very carefully, and we continue to be vigilant to make sure that, in fact, healthcare workers who have infection are not the source of infection, spreading it to their patients. And this is a concern that has led us to impose very strict disciplines within our healthcare institutions for them to monitor and to be vigilant when any of the healthcare individuals develop symptoms. They're taken out of circulation. They're not told to come back to work. They're put on a leave of absence in order to make sure that we safeguard the safety and welfare of our patients. So we continue to look after our healthcare workers, particularly those who are affected. We continue to support them. We support their families, just as we do for other patients. And we continue to also to make sure that they are not a risk to any of the other people, whether patients, relatives, or fellow staff members in our healthcare system, that they are not at risk as they continue to get care within our healthcare setting.